Hi, I'm Daniel Neumann. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Reputation, welcome and thank you for joining us for becoming AI's first choice, gain visibility and patient trust. As we all know, artificial intelligence is transforming the healthcare landscape. From generative search to smarter digital assistants, AI is changing the way patients discover, evaluate, and engage with healthcare organizations. But what does that really mean for your organization? And more importantly, how can you position your team to adapt and stay ahead as these technologies evolve? Today, you'll hear from two leaders who will help us explore these questions. Stacy Neumann, Vice President of Healthcare and Life Sciences at Reputation, and Carter Rees, Reputation's Vice President of AI and Machine Learning. Before we get started, just a quick housekeeping note. If you have a question at any point during the discussion, go ahead and enter it into the question and answer pane at the bottom of your screen. We'll respond to as many as we can before we wrap up. With that, I'll turn the program over to Stacy to kick us off.
Daniel, thank you so much. We really appreciate the opportunity to present to you today and for the lively discussion. AI is such an important and impactful tool that everyone is using today, or at least starting to use. And so we're really looking forward to the discussion. So today, and Carter, I don't know if you want to go ahead and move to the next slide. That would be great. Perfect. So today we're going to spend some time talking about the shift from traditional AI-driven driven answer engines. So we'll shift from traditional search and seek how patients are seeking to consume healthcare information, moving away from their keyboard and key-based search to conversational, intent-driven, and discovery model. We're also going to be talking about how HIPAA is really critical and at the center of all things that we do in healthcare, and how AI can really help be realized upon this foundation of trust, security, and ethical responsibility. And then finally, we'll touch on the strategic imperatives for AI integration. So with that, let's take it to the next slide. Wonderful. So before we dive into the details, let's just take a step back and talk about what's driving changes. The entire patient journey is evolving fast. Generative AI and LLMs are reshaping how patients search, learn, and interact online. Instead of official websites or provider directories, people are now having conversational, intent-driven, and interactions with AI tools that guide steps, fundamental shifts, and that's ready. So with that, Carter, do you want to talk a little bit about what's happening in the industry?
Yeah. So what we're seeing, and I think that everybody who's joined us today is noticing that when you go to your search engine, you go to a Google, you go to a Bing, all of those folks out there. We used to go to Alta Vista, if that dates me a little bit, back in the days of Netscape as well. But if you're going to these major search engines now, you'll notice at the top of the search engine that you're getting these summarized results. And it's really interesting because LLMs, large language models like OpenAI publishes, or Anthropic, or Google Gemini. So if you've ever heard of Claude, that's the company Anthropic. They summarize data, and data in this sense, text, very nicely. Answers your question in a natural language kind of way. And it's been shown that it's often the case now that people don't go past what the AI summary says. The amount of clicks on the first result that we're all used to from the major search engines, it's dropped. That we see that it's dropped, dip below 90% based on a study. And for Google, 90%, you can imagine that a drop below 90% for Google, that is a massive, massive number when it goes down. So what it really means is that there's a diversification in the search ecosystem. Patients aren't just simply turning to the keyword type search anymore. They're really looking at tools, and most of us here have probably tried ChatGPT, which has a search function. You may have tried or heard of Perplexity, which is another AI-powered search engine, or Gemini, put out by Google. That's got search engine capabilities, obviously, because it's a Google. So patients end up finding answers to their questions these days without ever going and looking at one of the keyword results. They just look right at what is AI telling me at the top, and that's where they stay. And that has a real impact on what it is that patients of healthcare providers are looking for and where they find that information. So search, of course, is the starting point. That's not going to stop. 77% of patients, they start their healthcare journey with a search. And on Google alone, there's roughly 70,000 health-related searches every minute. That is a lot. I know that I do it myself, rely on authoritative websites like WebMD. Seems like Cleveland Clinic is one that pops up all of the time. And so the digital visibility is no longer just simply optional. It really is the front door to the patient journey. So how search now works is very different than the way that it has worked in the past. People really appreciate large language models and AI search in terms of the synthesis of answers. And so now you see these beautiful, well-written, believable paragraphs that link to where did I get this information from? And it's all summarized for you. So no longer are you click link 1, did it answer me? Click link 2, did it answer me? It just pulls it all together and looks wonderful on the page.
Yeah, no, great. And with AI overviews redefining search and leading to the dramatic decline in click-through rates, what are the implications for healthcare providers when patients are increasingly consuming AI generative summaries as definite answers?
Yeah, so I think what is happening here is that because these large language models are so good at what they do, you're starting to see that traditional search decline, as we mentioned before, and you're starting to see the AI search becoming more authoritative. You're also starting to see the social influencers starting to come up with the content. They have a lot of them produce tons of content, YouTube videos, they've got blogs, they've got Instagram, TikTok. You're seeing a lot of their voice being heard as well, for better or for worse. And so these sources, they're honestly, it's driven by the fact that they're perceived as more direct, they're accessible, it's curated, and they give quick answers. But the quality of the answer, I think, especially maybe on the influencer side, you have to be a critical consumer of information. We always have been. But I think from my vantage point, there is always that layer of believability, and LLMs are very believable. They are fantastic. They are smart, but you've got to be a critical consumer of information. And so you're not just adapting to new platforms. What we encourage our clients to do, and anybody to do, is just reclaim the authority over your content. Your content, your website, your blogs, your frequently asked questions page, that's where you want to be the trusted voice. And that's where you should be putting your accurate and medical information, who your staff is, answers to health questions that you feel are common. Because what's happening is that the generative AI really is synthesizing all of your information. And what that means is that it is going to put it all together, and it's not just keywords. Okay, it is going to put it into a beautiful paragraph. It'll summarize. It's going to give the response or the searcher or the potential customer a nice bullet pointed list, and that's going to be the first impression that they see. So what's happening is it's always been about web optimization. It's always been about SEO. We're going to talk about GEO today. And so website design and UX still absolutely matter. And you're going to want to start tracking things like AI citation rate. How often are we cited in an AI response? Because for everybody on the call today, you can click the links that the content comes from. How often is your facilities or your providers mentioned in those links? And that's one of the big goals today.
Yeah. So, given the shift to trust as a critical currency in the new digital ecosystem and the importance of Google's EEAT framework, how can healthcare organizations effectively build and demonstrate trust to both patients and AI-powered answer engines?
Yeah. So I don't know how many people know what the Google EAT standard is. So I'll explain it a little bit, really briefly, but I would encourage everybody to look it up. So EEAT, it's experience, expertise, authoritativeness, and trustworthiness. And that goes into how do I get to the top of the rankings when somebody searches specific things on Google, for example. So you're always pushing towards making your content good, making it relevant, understanding what clients are or potential clients are searching for in the keywords. So that's why all the keyword bidding goes on and things like that. And so they're extending this type of metric and thought and trustworthiness and authoritativeness. It's extending to AI search now as well. And so it is that trust is what has become an absolute must in a world of AI. And I'm sure that we all know somebody who has absolutely no trust in AI because it's just too much voodoo. I don't understand what's going on in the background. There are others that are healthy skeptics, and even myself as a VP of AI, I'm probably the biggest critic, and so are my colleagues that are in the same position that I am. The most critical consumer of large language model outputs, because we know the strengths and weaknesses. I am a fan. I do promote it, but I promote it at a reasonable level and say exercise caution. Okay, so if patients don't trust the information that they find, and especially when it comes to healthcare, we know that this is a sensitive area, often matters of life and death. When people are looking for good information, they want that good information that they can trust, they feel good with, and they get a good outcome with. So that deficit shows up in some studies where like 37% of adults say their healthcare provider is their preferred source of health information. Okay, so think about that. 37% of adults say their healthcare provider is their preferred source of health information. Holy smokes. Okay. I absolutely trust my personal doctor. But what patients run into, and I think where AI is starting to fill the gap in terms of speed, it is just simply that oftentimes your healthcare provider who you do go to, it can be confusing. The information might be a little garbled, or it might just be completely over your head. And so they're looking for these nice answers, like speak to me in a way that I can understand it. And I'll give some examples of how to do that later in the presentation.
Yeah. No, that's a really good call. So if patients are gravitating toward what feels relatable or accessible, how can providers rebuild that sense of trust and connection?
Yeah, so I mean, humans are social animals. I've studied human behavior in a past life, and we tend to gravitate towards each other. We trust our closest friends, even if they're not experts in an area. We ask for advice, and we certainly ask for health advice. Who is a good pediatrician? I've got kids, and when we moved out here to Utah, that was one of the first questions that we asked people that we knew is who's a good pediatrician. So um, keep in mind that the answer is to make trust tangible and visible. Okay, and what I mean by that is they look for validation from other patients. And where do they find that validation? Oftentimes, they want it from a broad group of people. They find it online. They find it in reviews. They find it in Google reviews, WebMD reviews. And they're especially looking for, from what we have seen from our side, they're looking for a provider that responds to the reviews. They want to see engagement. They want to see, oh, I had a great experience here. And they want to see that follow up. And so that kind of validation of, yes, I see that you're a 4-star review. And then I also want to see you engage and talk. And all of that discussion in these threads, and an AI search engine will absolutely see it. So 70% of patients read online reviews before picking a provider. So the search always starts there. Um, and reviews carry, I think that this is interesting, is that reviews carry just as much influence on as do personal referrals. That is really amazing because I think that for a long time, as the internet grew, search grew, we were becoming more and more impersonal as the way that the feeling was, but we also connected through all of the internet. But those personal relationships were always number one. Well, with AI, because it feels good, it reads good, it talks to me in the language that I talk in, it's starting to replace some of those relationships. So what I would tell providers and practical steps, publish clinically reviewed and accurate and current content. Really, really own your content because that's what an AI search is going to grab hold of. So own your content. And I think today, even beyond SEO search, that's incredibly important. And you're the experts and know yourselves the best. Make sure that your content is good. And we'll talk a little bit about what good means here in a few slides. But I'll mention here generative engine optimization. So what that means is that that's kind of the replacement term now for SEO. So generative AI is the kind of thing that you see in a chat GPT, for example. All right. And so get your content right, make it look good, make it understandable, and you will be able to take advantage of what's going on.
Great, great. So earlier you mentioned something called GEO. I've been
Yeah.
hearing that acronym pop up more and more. Can you help us understand what it means and why it's suddenly such a big deal?
Yeah. So GEO, as I mentioned, is generative engine optimization. And so it's the evolution from traditional SEO to the AI search area. Okay, so AI driven conversational platforms like GPT, Perplexity, and Gemini, they're moving to that because the practical example is traditional SEO. You would ask, how do I rank on one page? Okay, GEO says, how do I make sure my healthcare information shows up in the answers patients get from AI? And those are two very different approaches to how you put your content out there. So it's really about getting that visibility into AI generated summaries. So the other thing is that there is a change. AI is influencing the change in human behavior. So instead of people typing in heart disease symptoms, you start to see people's behavior changing. And I think that we've all done it. They understand it's a conversational style. So they'll say things, what are the early warnings of heart disease?
Yeah.
Now you're putting in that more natural language, and LLMs love that. They love the content. They love the context. They appreciate more data in terms of how many words you get in there. So GEOs and it just is really ensures trusted, accurate, HIPAA-safe content appears when patients who are seeking help. It keeps your organization within the conversation.
Okay, so that makes a lot of sense. But for healthcare organizations that already feel stretched, what can they actually do right now to start showing up in those AI answers?
Yeah. So again, this goes back to in my world, it's natural language processing, NLP. Well, in the marketing world, in the AI search world, it's about that natural language. So I'll give you an example, and my wife happens to be a nurse, so she uses more formal language than I do. But now is that you write your page on your web page
Mhm.
in the language that one of your potential customers or your actual customers or patients would use. So patients search heart attack symptoms, let's say. They don't write myocardial infarction in their searches. Some of them might, but most of us would be like, my heart is racing. What is happening? And so when you're writing your fact page, when you're writing in your reviews, use that language that they understand. Don't go overly technical. And that's what your AI voice will start to sound like. You can put some of your pages on your website in more of just a QA format that directly answers patient questions. So before, the old approach might say cardiology department services, the GEO approach would be something like, when should I see a doctor for chest pain? Okay, that's a very different approach to it. And make sure, for example, that your business profile, your Google business profile, your health grades or ZocDoc or whatever it is you're using, make sure that that information is accurate. And we do understand that you'll have aggregators that aggregate information and then they publish it to a web page. Do your best to keep up with where all of your information shows up on WebMD, your local listings, and again, test the AI search engines. It's there. It is there for all of our customers to use, but you should test. Ask AI tools something like, "Where's the closest ER open right now?" See what the response is that you get back. Understand that AI search it's got this kind of because it is machine learning and deep learning in the background, it's got a random component to it. So what that means is that if you get into a nerdy term, stochasticity. So what that means is that if you ask the question one time and then you ask it again, it's not always going to give you the exact same answer in terms of how it's written. It will probably pull back the same citations and give you the same subjective readout, but it's not always going to look 100% the same. Test it out, see how you show up, and see what the changes are.
Yeah. Thank you. Thank you. That's great. So we know that more and more companies are claiming to be AI enabled, right?
Mhm.
What are we doing with this exciting new technology? And more importantly, how are we counting for HIPAA rules and regulations?
Oh, yeah, HIPAA. This is obviously a very big deal. So one of the things that we're working on and that we have pushed out to production here at Reputation is it's something called voice of brand. And generally what we're trying to do is we're using AI to make people more efficient. And I think that is where a lot of companies are finding value whether they are creators of AI-based product or whether they're consumers, is how can I use AI to make my teams more efficient, my day more efficient, summarizing data. And so what we've been doing is helping our providers respond to things like Google reviews in a way that keeps them on brand and efficient and HIPAA compliant. And we'll talk a little deeper about HIPAA here in a second. But what that does is it starts to help not only our clients build some trust with their folks, but also them building trust with AI themselves and in how to use it. And so we use natural language processing, which is a subset of AI, to do sentiment, recurring themes, and drivers of satisfaction and dissatisfaction. So we can look at things like if wait times are mentioned frequently, but we also take it another step to where you can ask a question to your own review data with our Rep IQ tool to say, who's the most popular salesman in my org, or salesperson or representative or doctor, and why do people like them? And so it will bring back all of that appropriate information and put it all together. So the HIPAA compliance is really a big deal. Everything we do thinks about HIPAA, talks about HIPAA, considers HIPAA, PHI, PII, and we are very conscientious about that. And we are very, very much, do not let AI just completely take over for you. We like and require human in the loop for that final review, because again, we want our customers to be critical consumers of information.
Yeah, I think the human in the loop is so important, especially as we're still here sometimes about hallucinations, and making sure that the human stays in the loop, especially with clinical care, is top priority. So
Mm-hmm.
looking at this slide, it really gets in the heart of AI and compliance intersected. When it comes to online reviews in healthcare, there's a lot of confusion on who actually owns the data.
Mm-hmm.
What does compliance look like, and how far AI can go in helping with responses? Can you break it down for us?
Yeah, so within the American Medical Association and then also the National Institutes of Health, if you go to those web pages here, and this is US based discussion right now, there's another discussion for the EU, but if you go there is piles of information on, if you're a healthcare provider, how do you respond to online reviews? What is appropriate? What isn't appropriate? And it comes directly from two trusted sources that are in this space and also manage the law around this. So just really quickly, the structure is HIPAA draws a straight line responsibility. So you've got covered entities defined as hospitals, clinics, health plans. Those are all the original custodians of the data. And then you've got business associates. So that's like us at Reputation. We're a business associate because we have healthcare clients. And we're the ones providing the AI response tool, for example. And so we share that legal responsibility to make sure that the PHI doesn't go out, that our online review responses are appropriate. And then we have our subcontractors, which is where we house our data. So we are a Google Cloud shop. You can think about Amazon Web Services, so AWS. You can think about Azure. Those are all the computing platforms. And so there's a chain of liability. It's not just a one and done. Every party touching this data, and even if it's public data that is related to a healthcare firm, there is the HIPAA responsibility. So you've got two things that you have to consider. You've got the privacy rule that governs what you can say. So think about it, for example, this is the example I always give. If a celebrity goes to a hospital, the media shows up, there is a big crowd, they want to know what's going on. That's when you see the media spokesperson for the hospital come out and say, we can neither confirm nor deny that so-and-so is a patient. That idea still applies to responding to online reviews. Okay, and we'll talk really briefly about that. The other one is just a security rule. That one governs how you protect the data, requires encryption, access controls, audit logs, and a good cloud architecture. So what does all of that mean? So number one thing, let's say that a review, it's public, it is written on Google reviews. How do you respond? And we have all seen it. I've even seen it within an Amazon review. How do you respond when somebody says, boy, I really like Dr. Smith. My hip replacement was amazing. He also helped me with some of my mental health issues by referring me to Dr. Neumann, for example. She was a wonderful mental health care provider. What you don't want to do is say, oh my gosh, we're so happy that your hip replacement went well and that you're feeling better and that your mental health issues are good. You need to respond with empathy. You can say thank you so much for the review. And that's about as far as you want to take it, because you don't want to even respond. HIPAA suggests, and the AMA suggests, don't respond with their first name. Don't respond with their name. Respond with empathy, respond with gratitude. And if it's a negative review, you can, if you would like, respond with, please contact us here. Okay, so the other thing that I think is really important to note here is that HIPAA and the privacy rules are for covered entities. So health plans, healthcare clearinghouses, healthcare providers, those are covered entities. But if you are not one of those, HIPAA still doesn't directly apply to you, but you should still be very careful with how you respond to online reviews. Because again, there was a huge review that I saw on Amazon, and it talked about having bipolar, being disabled, everything else. You won't necessarily get dinged by HIPAA if you mention those things in a reply, but there is plenty of case law, and I suggest everybody talk to your legal teams, okay, because I'm not a lawyer, but there is plenty of case law to where if you don't keep it generic, if you don't keep it empathetic, that you can run into privacy laws, local privacy laws, state privacy laws, tort law. And there are cases where people have won because that has taken place outside of a covered entity. So be careful. And when we build our products, we build all of those rules into our AI-based products.
Yeah, thank you. Thank you. That's so important. So we've talked a lot about compliance and the need for safe AI responses, but that naturally leads to a bigger question of how do you actually build the kind of AI foundation that makes all of this possible in healthcare? And what does that look like under the hood?
Yeah, so for us and for anybody just getting started, the biggest concern that we get is how do I know that my data, and I'm talking survey data as well, because that is very proprietary data. We deal with a lot of public data, meaning Google reviews that we pull off the web, but that survey data as well that we get because our clients ask their clients. So the number one thing I recommend for everybody is that you don't use if you're concerned about that, don't use a commercial product like ChatGPT. And this is a little bit of education here. OpenAI creates models that are called GPT. Okay. They have a commercial product that you all can purchase on a monthly subscription called ChatGPT. That has contractual obligations that are around the data that is very different than the way that we do it. We have an enterprise level contract that written in the contract, it talks about how our data is stored that it explicitly cannot be used to train any of the large language models on your proprietary data. We do not run anything through ChatGPT. And so those providers like Google Cloud, OpenAI, they are all HIPAA eligible, and they're covered under the business associate agreement, and they have all of the HIPAA compliance standards in place. So number one, our enterprise level contracts, and you should ask whoever you're working with out there, what do their contracts look like, and how do they use AI and to build that foundation. And so, I mean, you're rightly cautious about sending PHI or PII to an external provider. So the other thing that we are personally doing, just as a last comment on this, is we are currently working, because we have the compute horsepower, to train our own large language model internally so that everything stays within our ecosystem and doesn't rely on one of the big box LLM providers like an Anthropic or OpenAI. It doesn't rely on them to do the things that we would like to do with our customer data. So it's all completely locked down. All right. And so that, I think, will bring a lot of trust in our AI products here at Reputation, because then there isn't another business associate or a subcontractor involved. And the last thing I'll say on this is, just remember, there isn't a government certificate that anybody gets that says, stamp, you are HIPAA compliant. The HIPAA compliant comes into the agreement when you and whoever you're working with agree upon, I can trust you with my data because I can see that you take HIPAA compliance seriously. You're hitting all the check marks, and I agree that you're safe and trustworthy to work with. And risk levels are very different across different providers and competition for us, but we lock it down as tight as we can. And again, always keep human in the loop.
Yeah, thanks, Carter. So the last section really highlighted how healthcare organizations need both technical guardrails and ethical constraints baked into their AI systems. Now that we've talked about the secure foundation, let's get a little more practical. When AI is actually generating a response to a patient review, what kind of rules or guidance do you give it to make sure that it stays compliant and empathetical at the same time?
Yeah, so I would encourage everybody to go try this out within a product like Gemini, the Gemini app, or ChatGPT. When you use these models, and we do this in the background with our professional grade contract, you can give it a personality. You could say, you are, like I do this a lot, you are an AI and ML expert with design architecture experience of 20 years, let's say. And it takes on that personality because it's been trained on data like that. And so what we do here at Reputation for the HIPAA compliance is we give it a core identity statement, and we'll say you're a professional empathetic assistant drafting safe responses for healthcare reviews. And then we start listing the directives. Okay, so we'll say something like protect patient privacy and comply with HIPAA, never confirm or disclose health information, for example. And we have gone through and summarized all of the HIPAA steps, and you can bake that right in to the personality of the AI. And so it becomes, what that does is it makes it a non-negotiable center for every time, for example, with voice of brand, a review response is generated, the LLM takes that into consideration. And so some of the don'ts that we follow are, for example, these are some of the rules and regulations that we give our AI. So we set hard boundaries. So we'll say, don't confirm someone is a patient. Don't reference medical conditions, treatments, diagnoses, or medications, even if they're mentioned in the review. Don't give medical advice. For goodness sakes, don't give medical advice. Okay, that's not what we're here for. These boundaries, they teach the AI what not to say, but you can also teach it, what to say as well.
Yeah. That's great. So we just spoke about how we can train AI to respond safely. Now let's flip the perspective. What about the information that AI is pulling from in the first place? How can healthcare organizations make sure that the model is actually learning from their trusted content instead of something random online?
Well, I think let me mention this first. The do's. Let me cover the do's really quickly.
Okay.
So you can channel empathy within an LLM as much as an LLM can show empathy. You can always thank a reviewer. You can acknowledge emotion. Keep it concise. Keep it neutral. Keep it professional. So something like if there was a negative review, we're sorry to hear about your experience. Please reach out to our patient advocate at phone and email if you wanted to do something like that. If it's a positive review, just to express gratitude and reinforce general values, for example. And you always want to clarify general policies. I think that in the age of chat bots, you'll see most web pages, you can type in, hey, where do I find information on this? Or how does your particular product work? And you can own that content. But when it comes to online reviews, I'm always surprised at what people will put in a public forum, but don't discuss case details. That is just a big no-no when it comes to HIPAA and when it comes to security. And the other thing, just as an education piece, and you can also try this within ChatGPT or Gemini as well. It's something that's called view shot examples. So what we do is we will provide the LLM with, here's a prompt, or here is a review response. Do not do this. And it will be very specific. Here's a review and here's a response. Absolutely do this. And it will pick that up. It will absolutely pick that up.
Okay, so it in some ways it's sort of like a cheat sheet, right? For
Yeah.
AI. And it helps point it straight to the reliable stuff versus how hoping that it figures it out on its own. So how can
Mhm.
we, make sure that that happens?
Yeah. So the on what I've got up here is like the kind of forward thinking future standards of what the AI community is trying to do around this. So there is an organization, I think it's llm.txt.org, and you can look this up. And what the movement is, and it hasn't been fully widely adopted by OpenAI or Google or Anthropic, but there is a push towards this, is embedding in your website what's just an llm.txt file. And so right now you've got robots.txt for like security reasons and things like that. But what this file does, and it's just a plain text file, the suggestion is put your really clear content into this text file. It can be very small, okay, but put your information in there, and it's very structured, and you can list things in this text file because it's very easy for an AI to read and say things like, this is what we do and this is what this product is, and then here is the link. It doesn't need to be beautiful, it's just plain text. Here are common questions. You could say, these are the common questions we get all the time. Put it into that text file. And as you're doing this, you are becoming and putting out there the authoritative context and content for your particular website. And so what we're all kind of hoping will happen in the future is that OpenAI and the rest of these AI search engines will adopt that standard and train their AI to say, first of all, look for llm.txt within the website. If it's there, read that content as the authority of that particular entity. And that's the big goal of what they're pushing towards.
Okay. So we've talked about how healthcare organizations could shape their way AI sees their content, like through the llm.txt file, but I know that your team at Reputation is taking it a step further. Can you walk us through what you're actually building for healthcare customers and when it when it comes to AI powered products?
Yeah, sure. So I'll talk about voice of brand, and then I'll talk about rep IQ a little bit here. And this is just a general idea of how you can use AI to help gain efficiencies at your companies. So I've spoken a little bit about voice of brand, and generally what we want to do. I could give you like a property management example. I used to work at a company where we built property management software. And a lot of our clients never referred to their renters as renters. Their voice of brand and their brand voice online and then also face to face was they referred to them as clients. And so what we've done with voice of brand is that we baked in all the HIPAA compliance, but we allow our customers to define 15 rules like that to make sure that when they respond to reviews, they stay on brand. This is how we say this. This is how we refer to customers or renters. Say this, don't say that. Always be bubbly. Like we have also allowed our clients to pick certain personalities, and like we could make it a personality of you're a pirate if you really wanted to do that. You can go have fun with Chat GPT and say, talk to me like Kermit the Frog does to Miss Piggy. You could get them to do that kind of thing. But we allow them to put in their brand guidelines so that your voice on the web is exactly what you want it to be. And what we allow is that we will generate a review response for you, and then you can edit it, and then we'll analyze it for you and give you a thumbs up or a thumbs down of, is this on brand? And then, for example, if it's not on brand and then you want to hit send, so if you, for whatever reason, have a summer intern writing snarky responses to negative reviews, it will pause and pop up a little box that says, are you sure that you want to send this response? It is not on brand. And then that's the human in the loop part, is they have to confirm, yes, please send it. But even if you want to put in your own response, we can analyze it for you, give you the green thumbs up or a red thumbs down, and then you can say, enhance this with AI, and we measure it against your brand rules. And then if you do get a green thumbs up, you as the human following the number one best practice from HIPAA, you make the decision to send or not send. So that's one of the big things that we're doing. For the sake of time here, I mentioned here puckered VOB. Okay, so I want to explain what that means. We also have healthcare clients that are very concerned about, we have templated responses, okay? And it has been approved by their legal team. And some legal teams are more strict and they're learning about AI. Other legal teams, not so much. So what we are experimenting with and working with our clients with is that if you have a templated response of, if it's a positive review, you can respond with any one of these 10 responses. What you run into, though, is that if you have a bunch of the reused responses, Google will flag it and think it's a bot, and it will take down all of those reviews. And we don't have any control over that. So puckered VOB is what we're saying is that take the AI to take the templated response and then rewrite it, keeping the tone and keeping the general approach the same, but rewriting how it's said and satisfying the templated response that was previously there, just to avoid that bot detection. So something that we're doing, we're always experimenting and always trying to provide a lot of value to our customers.
Yeah, no, it makes a lot of sense, and it sounds like it's a really good balance between efficiency and safety. So, thank you for your thoughts there. That's great. So, we've seen that reputation AI tools are helping providers respond to patients safely and on brand. But I know you've also tackled another piece of the puzzle. So, how healthcare brands are actually showing up inside AI searches and search results. What's happening there with ARM?
Yeah, so ARM is a AI reputation manager. And what we're doing to make our customer experience more educational. This is a big education product for us, but also to make the experience with our platform fairly seamless, is that we are exposing the AI search engines within our product, and we will show you if you were to run this AI search, or if one of your customers, so our customer's customer, if you were to run this AI search on who is the best healthcare provider within this region or within this locality, what we want our customers to understand is that Perplexity might bring back one answer, GPT might bring back another, and then Gemini might bring back another. And so you see not only variation in the response within each of those products, but then you also see variation in the response across them. And so we want our customers to experiment with these technologies, and we will show them how do you deal with that variation. If you were to look up what are the office hours for Dr. Smith, each one of those might bring back the same exact answer, but they might use different citations. They might bring back, one might bring back an old version of if the doctor had moved, and another one might bring back, oh yeah, this is their new address. And so we're trying to help our customers not only understand that, but also bubble up to the top, are my business listings accurate? And how would I go about fixing them? And so ARM has a lot of capabilities. There's that educational piece. There is the keep your data clean, own your data, own your online presence, because this is the variation that you're going to see if you were a customer looking for the best local pediatrician. Because I don't think people often understand is that the if you were to search what's the number one pediatrician in my area, a pediatrician might come up first all the time. But if you're going to say what's the best, the AI has to interpret what does best mean. I mean, it does function in that way. So best is going to be related to reviews. Oftentimes, Google really loves to query its own reviews. And you might come up in the top 3 all of the time, but not consistently number 1. And so that variation is important for our clients to understand. And I think the last thing on here is just industry domains. It is really important to understand. ARM runs sentiment prompts for positive, negative, neutral feedback topics. And what are positive and negative or sentiment topics for Kindred Hospital, specifically about access to care, is an example that you might see somebody run a search on. So,
Yeah, I like that. So instead of one size fits all query, it's giving AI the exact content it needs to talk
Mhm.
about the specific location. So
Yep.
that's great.
Yep.
So this has been, Carter, just such a wonderful, great discussion. So thank you so much for that. We've covered everything from HIPAA compliance and AI prompts to how providers appear in AI search. Before we wrap it up, what are the key takeaways you want healthcare leaders to walk away with?
Yeah. Number one, and this is at the top of my list all the time. Again, there are appropriate skepticisms around how AI works, how much you can trust it, and how far you can push the technology. Again, I am one of them. Trust, trust, trust. And I encourage everybody on the session with us to gain trust in what it can and can't do. Go experiment and get educated. That will build not only your personal trust, but with whatever provider you're working for, you will understand how it can help, how it could hurt, and especially where it is necessary. And especially with your clients, trust is absolutely paramount. Okay, so, but get in, educate yourself, and understand the pros and cons. The next one is HIPAA. HIPAA, HIPAA, HIPAA. Set those guardrails. Whoever you are working with for your online brand reputation, ask them, how do you handle HIPAA? They should have a very clear answer. They should tell you exactly how they do it. There is nothing proprietary about HIPAA. You just simply want to know, how do you take it into consideration? And me being the nerdy scientist that I am, I always want trust and transparency out there. And I think the last big takeaway is take control of your content. It is not a world of SEO search anymore. Make your content conversational. Don't talk about myocardial infarction. Talk about, am I having a heart attack? That's a legit question that you can find on the web. So make your content conversational for your customers and make sure it is accurate.
Yeah. And that's such an interesting idea, right? Of human trust and machine trust happening together. It really changes how we have to think about online reputation. So thank you so much. And Daniel, with that, we'll pass it over to you. I know you've been monitoring questions and happy to start responding in the time we have left.
Yeah, thank you, Stacy and Carter. We do indeed have a few questions. Let's start with one that came in. Carter, the question is, they've heard of AEO, AI engine optimization, before instead of GEO. Is that the same as GEO?
It is the same, roughly. Okay, so let me grab my notes here, because I knew that this question would come up, but I didn't get my notes together. So it's optimizing your platform, and so for that kind of search, and so rather than just listing those links, it is doing roughly what GEO is doing. So there isn't a huge difference there. And I think that what is happening in the industry, and I can give a better answer than this once I get through my notes again. But what is happening in the industry is there is a little bit of a dichotomy, but so much of this is brand new that the lingo is still kind of being sussed out. And so if you talk about AI search engine optimization, the generation part is that this is generative AI. So they kind of go hand in hand with each other.
Okay, terrific. And I think that's sort of all the time that we have. So thank you both, Carter and Stacy. I'm sure the audience joins me in thanking you for the terrific insights you've shared throughout today's webinar. And thanks also to everyone in our audience for taking the time to join us. Please note that if you asked a question that we weren't able to get to, we'll do our best to get a response to you. And we'll also be sending out a link to the webinar recording, so watch out for that within the next few days. That concludes today's program. We hope to see you at future forum webinars and mark your calendar for the Healthcare Marketing Position Strategy Summit, May 4th to 6th, 2026 in Salt Lake City. Please visit the forum website at healthcarestrategy.com to learn more. And finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you all so much and have a great day.